10 Most Terrifying Facts About Mesothelioma. 1. Mesothelioma is a rare form of cancer that develops from the mesothelium, which is a protective lining that covers most of the body's internal organs, the lungs, the heart, and the abdominal wall. It is caused by exposure to asbestos, a mineral fiber that has been used in many industrial and commercial products. Approximately 3,000 to 3,500 people die every year from mesothelioma in the United States. Mesothelioma is a devastating disease, and some of the most terrifying facts about it include: 2. Mesothelioma can take 30 to 50 years to appear after asbestos exposure. This long latency period means that someone who inhaled asbestos fibers or worked with asbestos materials in the 1960s or 1970s could just now be experiencing symptoms and receiving a mesothelioma diagnosis. The cancer has usually spread by the time it is detected due to how long it takes to manifest. This long time frame also means that asbestos will unfortunately continue to be the cause of new mesothelioma cases for many decades into the future. 3. There is no known cure for mesothelioma, and the prognosis is typically poor. Most patients are not candidates for surgery at diagnosis due to how advanced the cancer has become by the time it is caught. Even with aggressive treatment including surgery, chemotherapy, and radiation therapy, the average survival time is only 12 to 21 months. Unfortunately, a mesothelioma diagnosis is often a death sentence, as it is considered a terminal form of cancer in most cases. This bleak outlook and short life expectancy can understandably be quite frightening to receive. 4. Mesothelioma often causes severe shortness of breath, chest pains, and fatigue due to fluid buildup around the lungs or heart. As the disease progresses, key symptoms include weight loss, nausea, fever, and night sweats as the cancer cells multiply and spread. Breathing difficulties are among the most common and frightening symptoms as the lungs become overwhelmed and blocked by tumors and fluid. Watching a loved one slowly suffocate to death from lung complications related to advanced mesothelioma can be truly harrowing. 5. Early mesothelioma symptoms, which include a cough and chest pains, are often mistaken for other less serious conditions like bronchitis or pneumonia. This means the cancer has usually reached an advanced stage by the time it is accurately diagnosed. Diagnosing mesothelioma early is challenging as the symptoms mimic those of other lung diseases. But a delayed diagnosis practically guarantees that the cancer will have metastasized to other organs, dramatically reducing chances for successful treatment. Not realizing the cause of persistent yet mild symptoms could actually be a fatal cancer is truly horrifying. 6. Pleural mesothelioma accounts for about 75% of all mesothelioma cases. This type of mesothelioma affects the pleura, the protective lining that surrounds the lungs. As it progresses, fluid builds up in the pleural space, which makes it difficult to breathe. This accumulation of fluid squeezes the lungs and restricts their ability to expand during inhalation. Severe breathing problems are a truly scary prospect and can cause gasping, panic, and potentially asphyxiation in advanced stages without relief. 7. Peritoneal mesothelioma makes up about 10 to 20% of cases. It develops in the peritoneum, which is the protective sac that surrounds abdominal organs. As the tumor grows, it may block or partially block the stomach or intestines, preventing food from moving through normally and causing abdominal bloating and pain. This can lead to digestive issues, vomiting, malnutrition, and intense pressure inside the body cavity. The physical and psychological agony of one's own cancer choking off their organs is utterly horrifying. 8. Doctors often have a difficult time determining the stage of mesothelioma, especially between stage 1, 2, and 3, since standard diagnostic tools like CT scans cannot always distinguish between stages. An advanced stage diagnosis is psychologically devastating and means having to immediately deal with the reality of a terminal illness instead of potentially curable disease. Stage 4 mesothelioma is typically resistant to treatment and has an even more dismal average life expectancy of less than 1 year. Facing a diagnosis that could be months away from death at any moment is unimaginably terrifying. 9. Asbestosis, a debilitating lung scarring condition, frequently coexists alongside mesothelioma in patients who had significant asbestos exposure. This makes breathing difficult even without the effects of tumors and fluid in the lungs. Between the fibrosis of the lungs and growth of cancerous masses, many patients essentially suffocate to death, which is an extraordinarily horrible way to lose one's life. Fighting two fatal and asbestos-related diseases simultaneously is a truly frightening scenario. 10. Mesothelioma usually presents with extreme, incessant pain as the cancer grows and spreads. Numbing pain becomes unbearable at times no matter the medication doses. Morphine is commonly used but loses effectiveness as tolerance builds over time. Yet increasing dosages also risks dangerous side effects and overdose. Knowing that strong, constant pain will torment a loved one into their final days as their disease progresses unrestrained can be absolutely heart-wrenching. Mesothelioma is a cruel, tortuous cancer with little to no warning signs until it has become too late. The physical and emotional devastation it causes, along with the horrific ways it can end lives even today due to past asbestos exposure, make it one of the most frightening medical diagnoses one can receive. While research seeks improved mesothelioma treatments, the tragic human toll of asbestos will sadly continue for many years to come across America and worldwide.